Hi, my name is Joel Chavez, and today I'm going to show you how to do a chest assessment. So the first thing you want to do is review the patient's chart for any significant findings or any data. So if the patient has any wheezing or crackles or anything that could contradict what we're about to do, such as if the patient is heavily sedated, he might not be able to cooperate for this. You're going to gather your necessary equipment. In my case, you're only really going to need your stethoscope. So once you gather your equipment, you're going to knock on the patient's room. You're going to wash your hands and introduce yourself to the patient. Hi, my name is Joel Chavez. I'm from the respiratory department, and I'm here to do a chest assessment on you. You're going to ask the patient to identify himself using two patient identifiers. So can I get your first and last name, please?
Luis Hernandez,
Your date of birth?
12993.
And you're also going to want to check the wristband for their medical record number. Okay, so like I said, I'm from the respiratory department. I'm here to do a chest assessment on you. There's really nothing to it. It shouldn't hurt. I am going to have to place my stethoscope on you, on your skin. So I might have to remove your gown down a little, if that's okay.
Yep.
So once you explain the procedure to the patient, make sure they understand it, and then you're going to be ready to begin. First thing you want to do is grab your gloves and ask the patient if they could sit up, preferably on the edge of the bed. Can you get on the edge of the bed for me, please? So now I'm going to pull down your gown a little. Always ask the patient first. You can remove their gown. The very first thing you're going to check for is called inspection. You're just going to want to check the patient's overall breathing status, if it's labored, if it's shallow, is he having any difficulty breathing. The patient seems fine right now. So you're going to want to head and start. So the first thing we're going to start with is the vocal phragmitis. You're going to want to use this side of your hands, and you're going to want to use both hands at the same time so you can feel any difference. And you're going to place your hands on the patient like this, and have the patient repeat the word 99 over and over again until you check all areas. So can you please say 99 for me?
99. 99. 99.
And you should hear some vibrations. You shouldn't really hear any dullness. If you do, that's something you're going to need to take a note of. You're going to want to do the same thing in the back. Try to avoid the scapula or any bones. So can you see 99 for me again?
99. 99. 99.
Okay. Next thing you're going to want to do is check for thoracic expansion. So you're going to want to put your hands kind of like a butterfly, like this. Wrap it around the patient, and you're going to have the patient take a deep breath in and out through their mouth. So can you take a deep breath in and out? And your hands should expand and come back symmetrically. The third test is you're going to be checking for the subcutaneous tissue. So you're going to check for a subcutaneous emphysema. So you're just going to want to feel around for any air, tenderness, or other indications. So that sounds fine. The fourth test you want to do is percussion with your non-dominant hand. You're going to want to place it on the patient, and you're going to tap it with two fingers, and you're just going to want to kind of snap your wrist like this and feel for the vibrations. You want to do this in a symmetrical pattern. So if you start from your left, you want to start from your left, then go to your right, down, back to your left, down, then again to your right. Then you're going to want to do this on the front and the back. And again, try to avoid the bony tissue. So you get your middle finger, two fingers, and you're just going to want to snap your fingers like so. Again, in a symmetrical pattern. So finally, you're going to want to auscultate, and so you're going to be placing your stethoscope on the patient. So I'm going to be placing my stethoscope on you, and every time I move it, I want you to take a breath in and out and exhale. You're going to want to exhale through your mouth. Your patient might get a little lightheaded when doing this, so it's all right if you take a break. So can you take a deep breath with me? You're going to want to start on the patient's side, and again move in a symmetrical pattern. So if you do right side first, go to your left, deep breath, and then you're going to start at the bases and work your way up. So can you take a deep breath? Deep breath. Deep breath. Are you feeling okay? So you're going to want to keep going. You're also going to want to auscultate on the front. Again, you want to start at the bases. Okay, take a deep breath. And the last place you want to auscultate is in the trachea. See if you can hear any stridor or any abnormalities. Okay, so you sound all clear. So once you do that, you're going to want to get the patient back up in his gown. You can go ahead and sit back down. You're going to thank the patient for his or her time, so thank you. They're very cooperative. Is there anything I can get you? You're going to want to remove your gloves, dispose of them. You're going to wash your hands. You can again thank the patient, so thank you for your time. Walk out, and you're going to record any relevant data you might have heard, so such as wheezes or crackles, or any tenderness you might have seen, redness, anything that's out of the ordinary. And that can let you modify any plans on the patient's chart.